you think Ron Paul has the most appealing approach to healthcare policy?
Absolutely.
Why?
Why? Let's see. Ron Paul has the best approach to healthcare because he wants to allow the healthcare to be sold across state lines, which would turn it into more of a free market.
Ron Paul is the only one running that actually practiced medicine before we had these government interferences, and he never took a dime from Medicaid or Medicare after they were created. He delivered 4,000 babies. He never turned a woman away.
I believe Mitt Romney does. In fact, I live in Massachusetts now, and you know, when he put in what they call Romney Care, what he was doing was he was establishing health care for those that did not have insurance. Children, men and women unemployed. He just wanted to make sure for those that may have lost unemployment benefits that they were insured. And I think it was we had over 200,000 people in Massachusetts alone that did not have health care. So he's been an innovator in the development of health care in Massachusetts, and I believe he'll do the same at the national level.
I think Rick Santorum. Just everything I've just kind of heard back and forth with some of the guys. I don't have too much of a problem. I think everybody's focusing more on just repealing something, but I think he had to focus, and at least it was in Florida. I thought he had a good answer to the seniors, and I feel like that. I got parents that live down there who are seniors, so it made a little sense to me, I guess.
Well, I mean, I think they all have certain platforms. Right now, I can't necessarily side with one over the other. I think they'll have to kind of shake out and see who the nominee eventually is, and then from there we'll figure it out.
Healthcare isn't a right, really. I mean, it's, if you're successful in life, you are able to get more, and with free market driving down healthcare costs, it would be more affordable for everybody, but government should not provide healthcare.
If it's a monopoly done by the government, they can drive the prices up or down, and it's always more expensive, and there's no competition. If it's a monopoly, the competition, I mean, that's how we get good services. I mean, why else would a doctor be encouraged to give you good services and a good price if it's a staple price across the board that the government chooses? Okay, this is how much for an MRI, this is how much for this is how much for your hourly visit. There's no competition.
Well, I'm Catholic, I'm a practicing Catholic, and this whole issue on contraceptives, even though I believe in contraceptives, I think it's an atrocity that the federal government would be involved in offering or telling people or offering free contraceptives to anyone.
I don't think it was mandated to have anything. I don't like anybody telling everybody they have to do something. I think that's what makes us Americans, that we don't have to do everything. We don't have to be told to do everything. We kind of have some choices.
The government interferes with what insurance I can buy. I want to buy myself insurance for car accidents and cancer and those types of things. And I want to pay for strep throat out of my pocket in a free market.
What steps do you propose in controlling the escalating costs of healthcare?
Allowing sale of healthcare across state lines. So if you have more people trying to drive down the price overall will go down.
I certainly support health care for all people, but I think there needs to be choice in where we get that coverage from.
We need a business person to communicate and work with healthcare plans and stakeholders and CEOs of those companies, and to put pressure on them to make changes and make it affordable.